Hi everybody, we're back live here at the Guidewell Connect Insights Lounge. My name is Kate Warnock and we're here at day 2 of the AHIP Institute and Expo. Very pleased to bring you Dr. Andrey Ostrovsky. Andrey, welcome to the interview.
Thank you very much.
Andrey, you are co-founder and CEO of Care at Hand, and you told me just a nugget of news right before we went live. I think that you deserve to tell our audience.
Yeah, we just announced this week that our company's been acquired. Our parent company is called Mindula Health, like doula for your mind.
Right.
They're a behavioral health case management company. So I'm very excited to not be the boss anymore, and also to not just offer software, but to actually have the full stack of service provision and technology.
Very, very exciting. So maybe let's start with a brief description of what Care at Hand is, and then we're going to talk about the session that you're about to lead.
Yeah, absolutely. Yeah. The technology we've built is a predictive insights platform, and what we've been able to do is predict whether patients will be at risk for going to the hospital in the subsequent 30 days. And what's unique about that is we're not using claims data or EHR data, but rather we're using the observations of non-medical care team members.
What a smart solution, and yet I bet you're the only one that I'm familiar with that is really tapping into this extended care team. Mm-hmm. So what a smart way to really get real-time information to help your predictive analytics.
Yeah, there's our emphasis is always making sure that the consumer, not just the patient, is having as good of an experience as possible and not having an already difficult situation be overly medicalized. Mm-hmm. So we've been very committed to looking at care team members that are not just people like myself, physicians, but the folks that often spend more time than any clinician does with the consumer or the patient. And so we've been inspired a lot by home care, by community health workers, home delivered meals, Uber drivers. There's just so many people that touch the consumer, family members, of course, that play a huge role, and we wanted to digitize their observations.
And from what I recall, Andrey, your solution is fully mobile, right? As far as the data collection, so it's a pretty frictionless way to capture that meaningful information.
It is mobile. About 1/4 of the touch points with our technology are actually in person using the mobile app. The majority of the touch points are telephonic, and so it's flexible that way, and which flexibility in technology is critical and something overlooked, but we have to reflect the needs of the care team and how they're interacting with the consumer, whether it's in person or over the phone.
So clearly, it's very obvious that when you were designing the solution, you really listened to your end user, and what a smart. Not something to be taken for granted in this space.
Can't sell software if you don't do that.
That's right. That's right. But but obviously you designed around what the experience was meant to capture. So, all right. So Andrey, let's pivot a little bit. Mm-hmm. Tell us a bit about this panel that you're getting ready to walk into at 1:15.
Yeah, it's a really exciting topic. It's a humbling topic. We're talking about the role of digital health in serving consumers or patients with complex needs, and we have a really fantastic lineup. Mike Payne from Omada, Wen Dobrowski, who's involved in so many things, who's also a clinician and an entrepreneur and healthcare executive. And I hope, will provoke the audience to some form of action in terms of how we design technology and how technology fits into the more important, bigger picture of financing and delivery processes. If nothing else, I will emphasize and always re-emphasize it's not about the tech. Tech is an enabler, and these consumers have a lot more pressing needs than worrying about an app or their provider worrying about an app. So there's a lot of design considerations and there's a lot of policy implications, and we've got some wicked smart, as we would say in Boston, people on the panel, so I'm very honored to be chatting with them in 20 minutes.
All right, excellent. With your earlier response and talking about your solution and the fact that you're really tapping into the observations of this extended care team, do you think now is the right time for the health industry perhaps to reevaluate the role that these people play?
It is very timely. The pressure that providers and, as always, payers have been under, increasingly for providers to shift towards value-based reimbursement, is pushing delivery model innovations to drive down the cost of how they implement what they're doing and drive up the ultimate effect size of what they're doing. To date, most of the innovation has been focused on clinicians, and these are expensive people. A doctor or PA or NP or an RN, they're expensive staff. Non-medical staff, non-medical care team members are a whole lot less expensive, and they also actually have competencies that are not clinical but equally as important in making sure the consumer is served well. So there's this confluence of a lot of factors with financial alignment and technology alignment that is, I think, going to be the next 5 to 10 years, really the decade of the non-medical care team member.
Well, that's a really interesting perspective, and perhaps not you directly, but certainly I think within the industry, there's probably two fields or two trains of thought. Technology is either the savior or it is a curse. You're obviously trying to solve for the utilization, the design of it, but how is it that we can really make sure that digital health is accessible to more clinicians, more of these extended non-medical people in a way that it's going to really help serve the community, the patients that they're here to help?
It comes down to a design capacity. I think our technology innovation ecosystem really lacks a sensitivity to the end user. Sometimes when we have clinician leaders or clinician entrepreneurs, there is some of that sensitivity, but to be honest, it really takes being a patient to understand how to design for the patient. And we don't all have to go get sick to design good software, but we all need to really connect with the end consumer of that technology. It could be a patient, it could be a provider. I think policy plays a crucial role here. The whole notion of technology being a curse, well, when there's a huge bolus of money to tap into, like meaningful use, et cetera, the design of technology may not be the priority, just rolling it out may be a priority. And not to say bad things about the meaningful use program, but ARA and that legislative vehicle was done very quickly, and they did their best at the time. I think we have a really neat opportunity to make policy be really well designed and allow for good technology design to flourish. We have great leadership right now in the government, and there's some pretty neat opportunities coming down the pike from a regulatory perspective.
And I think that that's an area that's maybe not as addressed as directly is that connection and the ease that regulation can really help better solutions make it to market.
Absolutely.
So good to have you as a champion in that role. So I've got another question for you, Andre. There's been a lot of press recently about the challenge for a health startup to prove that it's the next unicorn in order to obtain funding. How is it that you yourself were able to remain authentic in what your mission is and what your potential for care at hand is without also having to sell yourself as this unicorn in the making?
It is a very tough balance. I wrote a piece with my colleague Dave Chase in Forbes, I think about a month ago, kind of critiquing us as an industry of technologists. It's not just the technologist's burden, it's frankly the burden of what fuels technology growth or company growth, and that is the investment community. I think we have some very sensitive investors to what is the right thing to do in terms of directionality of innovation. But I would say the majority of investors only look at equity value growth, and that being the main value creator. Whereas, in fintech, or if we were talking about some fashion tech play or whatever, sure, that's fine. Grow a ton of multiples of an investment, but we're talking about healthcare investing, and people's lives are at stake. So I think there is finally, because of the regulatory and legislative vehicles I alluded to, there is an alignment with company value growth and creating true value for the consumer. A lot of that focuses on quality measures playing a prominent role. And I think we are at a really interesting time where I could see some pioneering investors saying, we're not just going to invest in a company based on, great founders and an audacious idea and $1 billion opportunity, but rather track record that demonstrates that the company's revenue growth is actually tied to improving population health, improving patient experience, and decreasing cost of care. That is going to be a very virtuous alignment of financial value growth and then value for the consumer.
Right, so efficacy really should play such a far greater role than perhaps it has, to your argument. That was a great piece in Forbes. I read it with Dave Chase. I really strongly encourage everybody to look it up. So, well, Andrey, we're going to let you get going because I know that you have to go get ready for your panel. Best of luck.
Thank you.
It was wonderful having you here, sharing your insights with us here at the Guy Will Connect Insights Lounge. My name is Kate Warnock. We're going to be up soon with our next interview. We look forward to keeping you here.